Swastiastu. We are from SGD B7. We are going to present about monkeypox pandemic in Sudan, Surveillance Epidemiologic Report 2022. So these are our members, and these are our contents we are going to talk about. And my name is Chokodes Ragunam Skoti. My last digit name is 252. Chapter 1, Introduction. So, the 2022 monkeypox outbreak in Sudan marked a significant public health concern. Sudan, like many African nations, has experienced sporadic outbreaks of zoonotic diseases, but the monkeypox outbreak in 2022 was particularly alarming due to its scale and impact on vulnerable communities. The Sudanese surveillance system documented a sharp increase in cases, especially in rural areas, where interaction between humans and wildlife is more frequent, creating ideal conditions for zoonotic transmission. The outbreak in Sudan illustrates the broader global struggle to monitor and contain monkeypox effectively, highlighting the importance of rapid public health responses and international collaboration. With that being said, we are going to discuss furthermore about this, why, to show the determinants of monkeypox in Sudan, to tell the natural history of monkeypox in Sudan, to elaborate the relevance of monkeypox to occupational diseases in Sudan, to describe the data sizes, numbers, examples, and their interpretation in this journal, to show the studies design in this journal, to evaluate the quality, accuracy, and clarity of the data analysis methods and presentation in the journal, to identify potential sources of bias in the study, to describe the identification and prevention of monkeypox outbreaks, to elaborate the surveillance system that implemented for monkeypox in Sudan, to tell the screening methods for monkeypox in Sudan, to elaborate the relevance of the report to disease prevention and community health. And the benefits we have too, the first one is for public community. It's to educate the public about monkeypox in general and its pandemic in Sudan, and to inform about the quality, accuracy, and clarity of the data, study design, and analysis method and presentation. And the second one is for the institution. It's for added knowledge sources on monkeypox and its pandemic in Sudan, as a teaching material to introduce students about monkeypox and its pandemic in Sudan, and to enable people to search deeper for more information about it as a basis for further research into the assessments, prevention, and treatment on monkeypox. And next, Chapter 2, Literature Review, is going to be explained by my friends.
Hello everyone, my name is Sidhu Gupta with the last 3 digits of name 072. So today I'll be explaining about what are the determinant factors affecting monkeypox outbreaks in Sudan area. There are 4 factors such as host factor, agent factor, environmental factor, and then the last one is the social factors. In the host factor, it easily can be transmitted or infected in children, which is 41% of cases in the age of under 5 years old, and then it affects primarily more men, slightly more men by the 54.4% than women, and in the immunocompromised individuals face a higher risk. And then the last one is that discontinuations of smallpox vaccines increase vulnerability of the infections. And then in the agent factors, it caused by monkeypox virus, which is an orthopox virus, and then it can be divided into the 2 strains. The first one is that it was African, which has a milder symptoms, and then the second one is that the Congo Basin, which has a more severe symptoms than the first one, and it can be transmitted via contacts with infected persons or objects or respiratory droplets. In the environmental factors, the overcrowding, personalizations, especially in refugee area, which is fairly common in African, in this case, the Gadar area, which covers 85.5% of cases. And then the second one is that the cross-border populations movement contributing to the spread of the disease. And then the last one is that the climate change alters habitats of zoonotic reservoirs, and then which increasing human to animal transmissions. In the social factor itself, we can usually defined as the higher infection risk in refugee and low-income populations, and then which attributed by the limited access to healthcare, hygiene, which can easily worsen the outbreak, and then the lack of lab testing delays diagnosis and the treatments. That's all from me. Thank you for your time.
Okay, my name is Mendaki Menangustia with the last digit number 105, and I want to explain about the natural history of monkeypox in Sudan. There are 4 stages of natural history of monkeypox. The first stage is susceptibility stage. Certain groups are more prone to severe monkeypox infections, including individuals with weakened immune system, young children, and pregnant women. The second stage is subclinical stage. After exposure, the incubation period for monkeypox is typically 5 to 13 days. During this time, the virus replicates, but the infected person doesn't show any symptoms. The third stage is symptomatic stage. The illness begins with a prodrome phase characterized by fever, headache, lymphadenopathy, and muscle aches. This lasts 1 to 4 days before the onset of rest, which starts on the face and spreads to the other areas in a centrifugal pattern. The rest progresses through various stages from vesicle to pustules. And the last stage is recovery, disability, or death stage. Most patients recover after the symptomatic phase. However, severe cases can lead to complications like bacterial infections or pneumonia. So that's all for me. Thank you. Next will be explained by my partner.
Om Swastiastu. My name is Brian Chandra with the last 3 digit 152, and I'm going to explain about monkeypox and occupational disease in Sudan. Those who work closely with animals, such as veterinarians, farmers, wildlife handlers, may be at higher risk of exposure to the virus. This occupational exposure can lead to increased incidence rates among these groups, making it essential to implement preventive measures and training to mitigate the risk. This study highlights that a significant portion of mpox were reported among preschool and school children, as well as refugees. The article emphasized the need for improved surveillance and control measurement to manage outbreak effectively. That's all from me. Thank you.
Hello, my name is Timothy Wangdat with 1025103 as my student number. And now I will present to you data sizes and numbers presented in a journal. Here we have gender distribution that we can calculate this by dividing one of the genders by the total population available in the journal. And here it indicates that there's a slight majority of cases involving men. And other than that, there is male to female ratio. And this ratio can be calculated by dividing the one of the genders to the other, yielding 1.19 to 1 ratio. This ratio shows a small male predominance within the outbreak, which is consistent with the gender distribution. Next, there's also children under 5 years as a category. And as it turns out, there's 154 children under 5 out of the 375 cases that are available. And a significant portion of those affected were very young. And lastly, there's an infection rate. This rate can be calculated by dividing the amount of people that are infected by the total population at risk, and then multiplying it by 100,000. This infection rate can give us a sense of the outbreak scale relative to the population. That is all from me. Thank you.
Thank you for the opportunity. My name is Rosa Felimena Sabudiarjo with the last 3 digits of student number being 168. And now I'll be presenting about the study design of the student project. So this study for the student project is a cross-sectional descriptive design with a retrospective epidemiologic analysis. The data includes mpox cases, time of infection, place and person, which is reported to the National Surveillance and Information Directorate or SID. The cases were classified as imported if the person got the infection from and spent the incubation period outside Sudan. The findings of this study have the potential to assist healthcare professionals in the world to be more aware about mpox pandemic and the development of focused prevention initiative through its case distribution variables. Hence, the utilization of the research strategy employed in this study holds the potential to effectively tackle the health issues and instances associated with monkeypox. That's all from me. The presentation will be continued by my friend.
Let me introduce myself. My name is Shane Clarice Marga with last 3 digit of student number 134. Now I will explain about the data analysis and presentation. The data analysis and presentation techniques utilized in this article are suitable and consistent with public health research standards. In data analysis methodologically, the study used a cross-sectional descriptive design, gathering data from the National Disease Surveillance Line list maintained by the Sudan Federal Minister of Health. This method is effective for providing a snapshot of the epidemiological situation during the outbreak. Based on statistical tool that was used, the data was analyzed with EpiInfo7 software, emphasizing the use of frequencies and percentage. This software is commonly used in epidemiological research for efficiently managing public health data. Furthermore, the results were effectively presented using tables and figures, improving readability and making it easier to interpret data trends, as visual aids play a key role in epidemiological reports by summarizing complex information in a concise manner. That's all from me. Thank you.
Hello, doctors and friends. My name is Madina Lamrani Mala, last 3 digits of my student ID number 106, and I'm going to explain about bias in the study. Due to a lack of data on monkeypox, this study has gaps and cannot be thoroughly examined. A lack of information on occupation and contact history in some participants may impede future investigation of risk factors and probable sources of infection in this study. Limited laboratory testing in Sudan leads to diagnosis based solely on clinical symptoms and does not provide data on circulating viral serotypes. I think that's all from me. Rest will be presented by my friends. Thank you.
Hello, my name is Kamai Widiani with my last three-digit R student number is 044, and I will continue the presentation 2.8 Identification and Prevention of Monkeypox Outbreaks. To identify potential outbreaks and initiate an investigation based on the study regarding the monkeypox outbreak in Sudan, there are initial steps taken to identify and investigate the outbreak. First is prepare for the field work. Preparation was made by coordinating the necessary workforce and tools for data collection in the field. Protective equipment and testing tools were prepared due to the infection risks of human-to-human transmission. 2. Establish the existence of an outbreak. The study shows that the number of monkeypox cases began to increase sharply starting from the 19th epidemiological week of 2022, reaching a peak in the 38th week with 101 cases and decreasing again in the 42nd week. Monkeypox cases were reported in 17 of Sudan's 18 states, indicating that the spread of the disease is quite widespread. The high attack rate in Gadaref, which is 20.3 per 100,000, indicates active spread of the virus in the region. The majority of cases are children of gestational and school age, who account for nearly 60% of the total reported case. High transmission in young age groups, especially in settings such as schools and refugee camps, suggests ongoing local spread, typical of an outbreak. Based on these indicators, the existence of the monkeypox outbreak in Sudan can be confirmed. 3 is verify the diagnosis. This step is important to find out the truth of the disease that has been identified and avoid errors in laboratory results in the increase in reported cases. The diagnosis was verified through laboratory tests, which RT-PCR for monkeypox virus of initial samples sent to the Robert Koch Institute in Germany. 4 is construct a working case definition. In the study, the case definition adopted followed WHO and Sudan's Ministry of Health guidelines, including laboratory tests and clinical diagnosis based on symptoms without laboratory confirmation. Due to limited the researches, the typical symptoms include fever, rash, headaches, and lymphadenopathy. 5. Find cases systematically and record information. New cases were systematically identified through the National Surveillance Network with data collected on patient symptoms, demographic, exposure history, travel history, and contact is important for tracking the spread of the outbreak and understanding possible modes of transmission. 6. Perform descriptive epidemiology. Mapping the scope of an outbreak can be done by plotting cases on an epidemic curve to identify peaks and map the geographic distribution of cases. Examining demographics such as age and occupation to understand who is most impacted and the possible causes. This step emphasizes vulnerable groups, including children and refugees in Sudan. 7. Develop hypothesis. The initial hypothesis suggests that the virus was likely imported from the other countries through cross-border travel. Additionally, the possibility of local virus circulation emerged over time. 8. Evaluate hypothesis epidemiologically. This hypothesis was testing using epidemiological data analysis. The results showed a distribution pattern in several border states, supporting the import hypothesis but also indicating possible local transmission. 9. As necessary, reconsider, refine, and re-evaluate hypothesis. As more data was collected, the hypothesis was refined. The data indicated that local transmission might be occurring, particularly in high-risk areas like densely populated refugee camps. 10. Compare and reconcile with laboratory and environmental studies. In the study, the outbreak was confirmed after 25 samples were sent to laboratories abroad with 72% positive result from the total samples tested. Due to Sudan limited laboratory facilities, only a few samples could be confirmed through testing, making clinical observational essential. Environmental studies can help identify possible source of infection, especially in location reporting many cases, such as the refugee camp in Gadaref. Conditions such as poor sanitation and high population density can increase the transmission. 11. Implement control and prevention measures. Control measures such as patient isolation and education campaigns in refugee camps were conducted to prevent further spread. Hygiene campaigns were also implemented to reduce infection risks. 12. Initiate or maintain surveillance. Ongoing surveillance was conducted by Sudan Ministry of Health to monitor the outbreak's development and detect new cases, particularly in previously affected areas. GP sought ensure continuous monitoring of cases and carried contact tracing, and report new cases to health authorities to help control the outbreak. 13. Communicate findings. The investigation findings were communicated to the public and relevant stakeholders to raise awareness about the outbreak and prevention measure. This communication also aimed to support future prevention planning and strengthen Sudan's surveillance system. Involvement of community leaders in places such as camp can help in efficient dissemination of information. That's all for the STEP investigation outbreak of monkeypox in Sudan. Now let me move on to strategies that can be used to prevent monkeypox. 1. Vaccination. The vaccines are available JYNNEUS and ACAM2000. JYNNEUS is a non-replicating vaccine which makes it safer for individuals with specific health conditions. ACAM2000, a replicating vaccine, can produce a stronger immune response but poses risks, especially for immunocompromised individuals. 2. Pre-exposure prophylaxis. This is recommended for individuals at high risk of exposure, such as laboratory personnel and healthcare workers who might come in contact with orthopoxviruses. 3. Post-exposure prophylaxis. For those who have been exposed, vaccination within 4 days is recommended to prevent the disease. If given between 4 to 14 days post-exposure, it may reduce the severity of symptoms. The preventive approach emphasizes vaccination for high-risk groups and rapid response post-exposure, particularly using personal protective equipment (PPE) and avoiding direct contact with potentially infectious material. That's all from me. Thank you.
Hello, my name is Gusti Agung Ardita Dharma with my last digit of name is 087. I will explain about surveillance system implemented for monkeypox in Sudan. This article highlights some aspects of surveillance undertaken by the Sudanese government in response to the mpox outbreak in the country. The first case was reported on 10 June 2022 in refugee camp through the Early Warning Alert and Response Network. Subsequently, the Surveillance and Information Directorate in the Sudanese Federal Ministry of Health initiated surveillance effort to collect data on mpox cases in the country, aiming to use this data as a reference for dealing with future cases. To this date, in Sudan, sentinel-based and infrared-based surveillance has been carried out in handling the mpox outbreak that occurred. Several steps can be taken to increase the effectiveness of mpox surveillance in Sudan. One of the main recommendations is to set up local laboratories capable of carrying out confirmatory tests, as currently only samples of initial cases are sent abroad for testing. Strengthening active surveillance effort is also important, with rapid response team actively seeking and investigating cases in the community. Additionally, the Sudanese government could focus on improving training of frontline surveillance staff at health facilities and local levels. These measures combined will significantly improve the country's ability to effectively deal with mpox outbreaks. That's all from me. Thank you.
My name is Hastadu Kristanto with my last three digit of ID number of 093. In this presentation, I'm going to present about the most appropriate screening method for monkeypox surveillance in Sudan. So, the most appropriate screening method is targeted screening. It is essential for an early detection and prevention of monkeypox, especially in high-risk groups. As it is known that preschool and school children are the most susceptible to monkeypox disease, and it is transmitted through direct contact, screening should be focused on young population, especially children who live in densely populated areas with poor environmental hygiene. Screening methods, such as skin swabs, should be conducted when a population shows early signs and symptoms related to monkeypox, such as skin rash, and identifying individuals who have been in close contact with confirmed case is crucial for breaking transmission chains. This can include family members, healthcare workers, and others who might have been exposed. That's all from me. The next part will be explained by my friend. Thank you.
Thank you for the opportunity. My name is Dagmar Sananta with the last three digits of name number 001. Today I will explain relevance of the report to disease prevention and community health. The report provides epidemiological insight into the global outbreak of monkeypox, a PHEIC, focusing on cases from May to October of 2022, particularly in Sudan. The findings could help manage and control disease, enabling early detection and prompt response, and aiding in the development of prevention and control initiatives. That's all from SGD B7. Thank you for your